Good morning friends, I am Dr. Ashna, gynecologist. Today we are going to discuss about vaginal discharge. Many patients come to us with the complaints of vaginal discharge. They think that the vaginal discharge is always abnormal and it is due to some infection. Here I would like you to know that vaginal discharge may be normal or abnormal. Vaginal discharge is actually the result of secretions occurring in our vaginal glands all the time. These secretions help to clear out the old dead cells from the vagina and keeps it clean. The color, consistency and the quantity of vaginal discharge may vary depending upon the phase of the menstrual cycle, whether it is early, mid or late phase of the cycle. The vaginal discharge may be more in certain normal conditions also, like in pregnancy, during sexual intercourse, or if the woman is taking oral contraceptive pills. So vaginal discharge actually keeps the vagina healthy and it is a defense mechanism of our body. Vaginal discharge may be abnormal if it is associated with itching, burning sensation, or there is burning during urination, or it is foul smelling. So if a woman is experiencing vaginal discharge, you must ensure that there is no irritation, no itching, no discomfort, no foul smell, then the discharge is normal. I also like you to know about certain common type of abnormal vaginal discharges. The most common type of vaginal discharge we encounter is the Kardi white kind of discharge, which is due to a fungal infection, candidiasis. This kind of discharge is usually associated with itching and the burning sensation. It is usually seen in certain conditions like if the patient is diabetic, conditions of decreased immunity, pregnancy, or the patient is taking antibiotic for long term. So all these conditions, this discharge can be seen, and this type of discharge has tendency to reoccur also. So taking personal hygiene is of great importance here. This type of discharge can easily be treated by the use of certain vaginal pessaries which can be inserted locally, or some oral medicines can also be taken to treat this kind of discharge. Next important type of discharge is the yellowish green kind of discharge, which is usually frothy. It is due to infections by Neisseria, gonorrhea, chlamydia, or trichomonas vaginalis infection can be there. It is a sexually transmitted infection which can be associated with pain, abdomen, fever may or may not be there. Oral medicine can be taken to treat this kind of discharge also. Next important kind of discharge is the greyish kind of discharge, which has fishy odor, which is due to bacterial vaginosis, which happens due to change in the vaginal pH. Another important kind of discharge I would like you to know about is the reddish brown kind of discharge, which may be normal or abnormal. It is normal if it happens 1 to 2 days prior to the periods, or it happens 1 to 2 days after the periods. But if the reddish brown kind of discharge happens without any relation to the periods, it happens somewhere in between the menstrual cycle, to which we call as intermenstrual spotting or intermenstrual bleeding, then it is an abnormal kind of discharge, which may be due to some local growth, cervical polyp can be there, cervical erosion, cervical cancer, uterine cancer. So for all these things you must visit a gynecologist. She'll do a per speculum examination for you to know about the cause, and if required certain investigations will also be done. So one must know about the common abnormal kind of discharges also. I would like you to follow certain precautions by following which you will be able to avoid these kind of abnormal discharges. The most important being the use of cotton undergarments, and you should make it a point that the moisture does not accumulate in the undergarments, as it allows the fungus to grow in it. Next important thing is, whenever you go to the washroom, you clean the local area from anterior to posterior side. Never clean it from posterior to anterior, because if you clean it from posterior to anterior, it allows all the bacteria from the anal area to go to the vaginal area, and this may be the cause of the infection. So always clean the area from anterior to posterior side. You must increase the intake of green vegetables and fruits in your diet. This will help boost your immunity. You must increase the use of probiotics in your diet like charch, dahi and yogurt. All these things, they maintain a good vaginal pH and help prevent bacterial vaginosis. You must use barrier methods during intercourse to ensure safe sexual practices. This will prevent any local infection from getting transmitted. So and you should also prevent the use of you should never use deos in the vaginal area. Use of deos should be completely stopped. By following all these precautions, you may prevent the vaginal discharge. I hope today's video will be helpful to you. Thank you.